Nicola Hill joins us now live from London. Nicola, good to see you. I'm just thinking this is really incredible because these are, in the UK, primary school children are aged between 5 and 11 years old. I hope that hasn't changed since I've been here in Turkey. But a 5-year-old going to school, putting on a mask, I mean, it must be so difficult. So how significant is this research?
Yeah, I think it really is quite important research. What it actually is a meta-analysis. It's a look at 32 small studies from 21 countries around the world, and then looking collectively to see basically, how susceptible are children to the coronavirus. And they found that sort of children and adolescents are about 40% less. The younger children, those between, and you say 5 and 11, it is still that figure here in the UK for primary school. It's even higher, it's 48%. So they're only half as likely as adults to get the coronavirus. And we have had the author of this research, Professor Russell Viner, saying that, when a child turns up with a snotty nose, a cough or a cold, that's what they've got, a cough or a cold. And we need to stop testing them and closing schools or sending classes of them home. I was speaking to a paediatrician here in the UK, Dr. Ravi Jairam, who works at a hospital up in Chester in the north of England. And he said that during the pandemic itself, the height of the pandemic, he was really quiet. Over the summer, he was really quiet. Schools have reopened. All of a sudden, it's as busy as December. Because basically, if you think of in the summer holidays, 6 weeks, kids don't mix. They go back to school, they pass germs. If they've been separated for 6 months and then they all get back together, that's loads of them sort of mixing with germs. So no wonder they're turning up at hospital with a tight chest and something like that. And Dr. Jairam said to me that not one of them has had coronavirus. They're just respiratory infections. And my next door neighbour's son last week, went back to school, had a cough. We could hear this cough. It was a croupy cough. It was a chesty cough. But it was a cough, so he had to get tested. The whole family had to isolate. The siblings had to stay at home. And then when the test finally came back negative, he could go back to school. So Professor Viner and Dr. Jairam are both saying that, unless children have the obvious signs of the coronavirus, which is this loss of taste, loss of smell, and a persistent dry cough and a fever, they shouldn't keep being tested them if they've got a runny nose, if they've got a snotty nose, as Dr. Jairam puts it. Then they've got a cold that kids get when they start mixing together, and they should stay at school because they need it for their mental health and to socialise.
Absolutely. Very briefly, we've got a minute left, Nicola. What does this mean for targeted testing and knowing which age groups can go back to school safely?
Well, at the moment, what they don't know is if these children are more likely to be passing it on. So targeted testing for them isn't necessarily the case. But perhaps for the older ones, the big problem we've got here in the UK are university students who have now sort of gone back to university or gone to university, shown that they've got a few of them have been tested, so they're all being locked into their home, their halls of residence, and it's causing mayhem. A lot of the students are saying this is not what they signed up for. They'd rather stay at home and have online lessons rather than go to a university and be locked into a hall of residence.
Yeah, it's really, really concerning what's happening at the universities, especially at Manchester. Following it closely. Thank you so much, Nicola Hill, live from London.